How to inject Menopur with a mixing needle, intramuscular. Presented by Fuze Health. How to store your medication. Store Menopur at room temperature or in the refrigerator until the expiration date on the label. Once mixed, it must be used immediately and any unused portions should be discarded. Supplies needed. You'll need 1 vial of diluent, at least 1 vial of Menopur 75 IU's powder depending on your dose. For example, if your dose is 75 IU's, you will need 1 vial of powder. If your dose is 150 IU's, you will need 2 vials of powder. If your dose is 225 IU's, you will need 3 vials of powder, and so forth. But for today's injection, we will prepare a dose of 150 IU's, or 2 powder vials. 1 3 ml syringe, 1 mixing needle, 1 injection needle, alcohol swabs, sharps container, gauze or tissue, optional. Examining your medication. Before starting, wash hands thoroughly. Work on a clean surface and inspect your vial. The liquid should be particle-free and not cloudy. Prepare the medication. Flip off the caps from all your powder and diluent vials and wipe the stoppers. Assemble your mixing needle and syringe and remove the cap. Pull back plunger to draw air into the syringe that matches the amount of diluent you are instructed to mix with. For Menopur, it is typically 1 ml. Insert the needle into the diluent and slowly inject the air. This step makes it easier to withdraw the liquid because the vials are pressurized. Invert the vial and withdraw your prescribed diluent amount, for example, 1 ml. Ensure the needle stays submerged by slowly backing the needle out of the vial as you withdraw. This ensures you are drawing liquid and not air. Remove the needle and discard the used vial of diluent. Locate your first Menopur powder vial and insert the needle through the stopper. Slowly inject the diluent into the powder. Menopur dissolves instantaneously, but you can swirl the vial to make sure it's thoroughly mixed. Do not shake. Invert the vial and withdraw the entire contents of the vial back into the syringe, keeping needle tip submerged. You have now mixed 1 vial of Menopur powder for a dose of 75 IU's. If your dose is 75 IU's, you're done and can skip to the injection steps. If your dose is more than 75 IU's, continue to the next steps to mix your subsequent powder vials. Locate your second Menopur powder vial and slowly mix it with the mixed solution from your first vial. Swirl to make sure it's thoroughly mixed. Invert the vial and withdraw the entire contents of the vial back into the syringe, keeping the needle tip submerged. You have now mixed 2 vials of Menopur powder together for a dose of 150 IU's. If your dose is 225 IU's, mix 1 more vial of Menopur powder with this solution. If your dose is 300 IU's, mix 2 additional vials of Menopur powder, and so forth. After you are done mixing, recap the needle by scooping the cap up with your needle to prevent needle sticks. Twist it off and discard it into the sharps container. Switch to your injection needle. Tap out air bubbles and push the plunger gently until a droplet appears. How to do an intramuscular injection. The upper outer quadrant of the buttock muscle is the most common location for an intramuscular injection, but always check with your provider to ensure you are injecting at the right location. Tips to reduce injection discomfort. Warm the vial or filled syringe before use. Ice the injection site before injection. After injection, massage the injection site and apply a warm compress. Rotate injection sites. You are now ready for your intramuscular injection. Clean the injection site with alcohol. Firmly stretch the skin at your injection site with your thumb and index finger with your non-dominant hand. Hold the syringe in your dominant hand. Insert the entire length of the needle into the stretched skin at a 90-degree angle with one swift motion similar to a dart. Stabilize the syringe with your free hand and pull back slightly on the plunger. If you see blood, do not inject the medication and withdraw the needle. Apply pressure to the injection site with a gauze or tissue and discard the syringe into the sharps container. Repeat your medication preparation process and inject at an alternate site. If there is no blood, the needle is inserted properly and you can inject the medication. Slowly push on the plunger until all of the medication is injected. Quickly withdraw the needle and discard it in the sharps container. Apply light pressure. Bleeding, bruising, or redness at the injection site is common. You might also see a drop of liquid come out of the injection site. This is common and should not be of any concern. Great job! You have completed your injection. If you have any questions or need support, contact your healthcare provider or reach out to Fuze Health.